Farhan Ahmad from Reading. Traditionally, we've been quite cautious about stenting the popliteal segment. And, it's a point of flexion, potentially a site of future bypass. And we've had several patients who have had popliteal disease. We've said, no, we won't consider them. Are we being overly cautious?
I would defer to my IR colleagues. Nick, what do you think?
We've had exactly the same thoughts, and I know exactly what you mean, but I'm, as I say, gradually increasing my area of uncertainty about what works, what doesn't work. One solution in this situation doesn't apply to the drug-eluting stent, but there isn't. I don't think there's a particular drug-eluting stent designed for the popliteal, so it doesn't really apply to BASIL 3. But there are obviously one or two stents on the market which are being promoted for the popliteal segment, but that's not really relevant here. Primary stenting of the popliteal. It's an area for personal judgment. My own area of uncertainty is increasing. I don't have an absolute rule about not stenting the popliteal.
Yeah. We've heard that comment, that what you've said a few times, but then on the other hand, we have many patients being randomised in many centres where they've been happy to do that. And again, it's one of these variations in opinion that you get when you go from centre to centre. I guess in the end, if you just feel it's absolutely the wrong thing to do, but perhaps you just need to broaden that area of equipoises.
We do get that. That's a comment that's frequently given to us in lots of meetings that we go to, and I can understand the hesitancy. We did look at the literature because it was coming up quite frequently, and there's nothing in the literature to suggest it's a good or a bad idea. And we certainly have centres that do not care and will do it, and they get just as good as results stenting and not stenting. But we do also have centres that are uncomfortable and won't do it.